Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Thank you for having me.
Yes, sir. I wanted to talk about something internationally first. So there are international reports that indicate that Pfizer and Moderna would need to scale up manufacturing to meet the demand for enough vaccines. You had spoken about this early in the week, but I wanted a little bit of a refresher. Is there cause for concern in terms of shortage in Ghana?
Well, first of all, the Pfizer and Moderna vaccines are the ones that are approved by a number of countries, like in the United States, Canada, UK, Europe. Australia has recently approved the vaccine. And these countries had pre-ordered vaccines, so they are now getting their quota. Other countries have been negotiating with Pfizer and Moderna, and you have the COVAX facility through which Guyana is going to get vaccines. So through that mechanism, they have been negotiating to be able to acquire vaccines. And we are going to get our vaccine through that mechanism. So I don't think, while they, in terms of its global production, Pfizer and Moderna, because it's something that is in demand, I would believe that they would be able to scale up and make sure that they're able to supply vaccines to those countries and facilities that have negotiated with them.
I like to make it a point to note that we're still within that period. We're not late then per se, because from last year to now when we've spoken, this was the time frame given, so we're not in any way late, because people are tending to think that we were behind.
No, well, the thing is that those developed countries are rolling out their vaccination programs, and the rest of the world is also looking at how they can start rolling out their own programs. And most countries are dependent on COVAX to be able to do so. COVAX has recognized that, and COVAX has been making attempts to see how fast they can procure the vaccines and be able to give it to countries. They have also, at its most recent meeting, considered doing a first wave of vaccines for various countries. And Guyana was one of the countries that was asked to submit proposals to COVAX to participate in this first wave. We have submitted all our documentation, and we are awaiting an answer from COVAX. And once we get that answer, there is that possibility of getting vaccines a little bit earlier.
Okay, as we're on...
It will not be in large quantities, but certainly you'll be able to get some vaccines earlier.
Yeah.
It all depends on COVAX.
And we had discussed that too, the first 3% followed by the 17% and so on. Thank you, Minister. As we're on the topic of the vaccine, last time we spoke, last week rather, and the week before, you talked about persons with having an unhealthy diet and not particularly looking at what they eat and so on, and that impacted them in terms of COVID-19. So I wanted to talk to you about smoking and the risk factors.
Well, we know that smoking can lead to, or is the risk factor for a number of disease conditions in the human body. We know that it contributes to respiratory diseases, in some cases because of the actual content of the smoke, the active ingredients of the smoke, is made up of a number of carcinogens. I think in one of the studies that were done, smoke actually contains about more than 20 different types of carcinogens. And a carcinogen is an active substance that can result in cancer formation. So if you're smoking on a regular basis, you are you're subjecting your body to these ingredients, which can ultimately lead to a disease state. So we also know that smoking is one of the risk factors for cardiovascular diseases. And then, so if you're actively smoking, it can contribute to respiratory diseases, cardiovascular diseases, cancers. All of these fall in the category of non-communicable diseases, and persons with these types of comorbidities are more at risk for COVID-19. So that's the nexus. And therefore, if during this period, those persons who have been active smokers, if they can start cutting back and reducing the cigarettes that they're smoking and eventually try to kick the habit, I think that would be a positive thing, and it would enhance their ability to withstand or be at lesser risk for COVID-19.
Those persons vaping as well, it's the same for them as well?
It depends on what they're using to vape. So if they're using nicotine-like products, then certainly that would contribute to to developing various disease conditions.
Touching on another topic, I know the National Reference Lab and Eureka were the main testing facilities basically, but I saw an ad that said that the ministry had given permission for testing to be done, but it's not the PCR testing. Could you guide us?
So maybe we need to make it abundantly clear. There are two types of tests that can be used for diagnostic purposes. When we said diagnostic purposes, we mean to diagnose if someone has COVID-19. The two types of tests that are broadly used, we can put them into broad categories. These are PCR tests and antigen tests. PCR is a very complicated test to do. So you take the swab, but then when you process the swab, it's different. And so there are only, in Guyana right now, there are only 2 laboratories that are capable of doing proper PCR testing. And these 2 labs would be the National Public Health Reference Lab, that has been certified to do this type of tests and has been doing this type of tests, and the Eureka Medical Laboratory. So these are the only 2 certified labs to do PCR testing. Now, antigen test, which is a much simpler test, again, you do the swab, you take the contents from the swab, and you put it in a test tube, you twirl it around about 5 times in a specialized liquid, and then you use that liquid and you put it on a strip. And you wait for 10 to 15 minutes, depending on the type of test that you're using. And if it turns, if you see the lines, then you would know that it's positive. So that's a much simpler test to do. And it takes sometimes 15 to let's say 30 minutes to accomplish all of that. Now, the United States has been accepting, well, they have introduced new rules for travel. And as of yesterday, to go back to the United States, you would require either a PCR test or an antigen test, which was done in the last 72 hours. So within 72 hours, if you have tests to show that you have done it, then they will allow you back into the United States. Because the antigen test is a simpler test to do, the Ministry of Health, through its technical division, has been able to go around to a number of health institutions, people who have traditionally been providing health care, such as the Balwant Singh Hospital and Woodlands and so forth, and review whether or not they have the capabilities of doing antigen testing. And all of them that we have published have agreed that they're able to do it. They have been doing it. And so we have now licensed them to be able to do these tests. If they have a positive test from the testing that they've been doing, they have an obligation to report that to the Ministry of Health so that we can be able to follow those persons up and so forth. So there's also a protocol if somebody tested positive. And of course, if they have a negative test and they're testing themselves for purposes of traveling, then they can present themselves to the authorities at the airport. We are going to continue to expand that list as we review more places, and we also want to certify regional facilities where this type of testing can be done. So this is an ongoing thing. During this week, they have also visited a number of other facilities, and they will continue to do so next week as well. And we'll update the current list that we have.
Okay, Minister, thank you so much for explaining that.
And also one other thing is that PCRs are usually quite expensive. The antigen test is far cheaper. And therefore, I think more people might be gravitating towards that, especially if they have to get that for traveling purposes.
I have a question from HGP Nightly News, and they're asking, this is their question, there is an allegation by the parliamentary opposition that some ministers of government have demanded that results of staff who test positive for COVID-19 be sent to them directly and not the staff, and they're asking, could you confirm whether this is true, or if so, why is it being done?
Well, I'm not aware of any such case, and if the parliamentary opposition, if they have specifics, then they can certainly pass that on to us here in the ministry so that we can do a proper investigation. But our protocol has been, and still is, if somebody present themselves to one of our facilities for testing and they meet the requirement for testing, then we'll do that test. And when the test is completed, so if it's an antigen test, they can get back the results right there within the 30 minutes. If it's a PCR, generally you get that back within a 24-hour period. Once the lab has completed the test, those results are then sent either to the HEOC and disseminated to the region from which the sample came. And the health people in those regions are the ones who would then follow up by calling the person and telling them the status, whether they're positive or negative. And if they're positive, would give them additional instructions as to what to do. For example, how they can isolate at home and so forth. So they have a checklist that they'll have to go through. And then if you're positive and you remain at home for that 10 days, there will be other persons who will be checking in with you during that period to see how you're doing and signs and symptoms and so forth. And if you remain asymptomatic for the duration of the 10 days, then you will be discharged. And upon discharge, you will be issued with a discharge certificate. So for purposes of work or whatever you might need that certificate for, you can then produce that if your workplace requires it to show that you have been discharged and you are now considered to be COVID-free. So that has been the process that has been operating over the last several months, and that continues to be our way of operating.
Okay. They have a follow-up question, and they're asking, on the matter of privacy, contact tracing, can you safely say that your team has ensured that the key elements of privacy are not abused or disregarded during contact tracing? At the moment, what is the ministry's preferred method of communication for the purpose of contact tracing? And you just explained that.
Yeah, well, I think the question is a little bit jumbled, because if somebody tests positive, then we will interview that person as well to get a sense of who they have been in contact with over the last several days. And if they can recall where they've been, who they've been in contact with, they'll give us a list. And based on that list, we would then be able to reach out and alert those persons that they might have been exposed because they would have been in contact with somebody who was tested positive. We don't share the information of who might have been that positive person, but we want to alert the others who might have come in contact with that person and then get them either into quarantine so that we can observe them to determine whether they develop any signs or symptoms, or in some cases to get them to come in to do an antigen or a PCR test so that we can ascertain whether they're having been exposed, whether they're positive. Generally, after the time of exposure, we generally would want to wait at least for 4 to 5 days because that's the time when we will see signs and symptoms. But because in this, with COVID-19, a lot of people also are asymptomatic, you might not get any signs or symptoms after 4 to 5 days. But if you do the PCR or you do the antigen test, you would get a positive results. The antigen test generally works better when we see people with signs and symptoms. We get a better correlation with those persons. But PCR, we are able to pick up with person who might be asymptomatic. So that has been our protocol, and we continue to use that. Medical professionals, it doesn't matter what level you are in the profession, you have to uphold confidentiality of the clients that you're dealing with, and that's part of the professionalism of the medical professional. So, we have been instilling this in our training, and we continue to do so because, being able to retain confidential information and working with people, that's one way of how we can earn their trust and be able to treat with the various conditions and make sure that people are comfortable with the care that we are giving to them. And so we continue to do that.
All right, Minister, thank you so much for speaking with us today.
Thank you.
All right, well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.